So, Greg, can you hear us? You got to take off mute.
You should be good now, Greg. You good?
Yep.
There it is. Perfect. Thank you. Good evening. For the record, Gregory Morse, registered engineer, Morse Engineering. On the line with me tonight is attorney Bill Orenberger, as well as Frank Colpois from the Hatherley Country Club. This is a request for a septic system approval to replace the septic system for the clubhouse. The system that's out there right now has had some difficulty over the years. They're looking to replace it. The system that's out there consists of a 3,500 gallon grease trap, a 10,000 gallon septic tank, and a crushed stone leaching field. What the proposal here is, to add a second grease trap of 1,000 gallon capacity in addition to the existing, to add a second septic tank of 5,000 gallon capacity, and to construct a new leaching field. The leaching field would be a Presby Enviro septic system, 51 feet by 77 feet with 2,475 feet of Presby pipe. There's a local upgrade approval that we're requesting. The local upgrade approval is 15.405B, which is the cover over the septic system. Over a portion of the proposed leaching field, we're asking for a maximum cover depth of 4 feet. 3 feet is typically the requirement. Title V allows up to 5 feet of cover with a vent installed. We're asking for 4 feet of cover. We do have the vent installed, or proposed to be installed. Secondly, Title V allows Board of Health to approve alternative design flows. 15.203, Section 6. Alternative design flows are for when a facility does not specifically fall into one of the criteria outlined for Title V on what to use for septic capacity. In this case here, the Hatherley Country Club is a private membership club. It has a capped membership, and it really consists of two parts. There's a dining facility with 260 seats. There are also locker room facilities for golfers with 304 lockers in total. If you did a traditional Title V design flow for the facility with 304 lockers and 260 seats, it equates to 8,680 gallons per day of flow, which is extremely high compared to what the club actually uses. So Title V has provision 15.203 for these very cases. 15.203 specifically says if you look at the water records on what a facility has used, you can look at the water records over the past 3 years, and you can take 200% of that as a factor of safety and design for that scenario. That being said, the Hatherley Country Club typically uses, in the last 7 years we looked at, it used a total of 2,416 gallons per day during its busiest quarter in the last 7 years. You know, it is essentially a seasonal club. They get more flow over the summer than they do over the winter. So that's what we took. We took their highest flow experienced in the summer. We put a safety factor of 200% on that. So we're designing for 4,832 gallons of flow per day. The septic system itself otherwise meets all Title V requirements. It's located up adjacent to the clubhouse. It complies with all setbacks. It complies with groundwater for the Presby system. I turn it over to you.
Okay. Joan, do we have any questions, or I can't open up the plan to see it on my end? Drew, do you know?
No, I mean, as Greg said, it is what it is, and the reason Title V has alternative systems is so that they can, get the best possible system that they can in the area where they need it. So,
Okay,
I mean, it is what it is.
all right. Does,
So
Oh,
I
there's
just
Jen.
have
There
a
you go.
question. I have a question. So we currently have a food permit for 175 seats. So are you increasing to 260? So this is going to be a larger size system than what's current, correct?
I don't believe that to be the case. I believe there were 260 seats capacity inside of the building. And so that's what the design flow is. We're not proposing any additions or new seating area.
Okay, so we're going to have to get that clarified with the country club because their food permit says they have 175.
Okay. I can ask them to clarify that.
So we just,
They might,
if they could,
there might be a difference between seating in the dining area versus maybe if there's an outside snack area or a bar area. I'll get an answer on that for you, John.
yeah, if we could just find that out, because then you'd be increasing the number of seats. And so we just want to make sure that the food permit has to match the septic, is what I'm saying, so.
This is Bill Arnberger. If I could speak for a second to answer Joan's question. Joan, there's no proposed increase of patrons capacity or anything else. I'm not sure if that 260 number has to do with occupants versus actually seats for dining, but there is no, all we're looking to do is to service the existing capacity. It's been the same for the last 10 years. That's all.
Yeah, so I just don't know why 175 seats were put on the food permit. If you have 260.
When we can have Joe go down and just make sure that the seat numbers match
Yeah.
if you want.
But I guess, Bill Arnberg, I guess my question is we're not what it is, what it is, and the numbers that Greg have used was based on the maximum above this. So if the seats are less than this, then it makes the reduction even more compelling. So that's what I would say. One of the things is we are scheduled next Monday to be at the Conservation Commission because part of the grading is in the Scituate floodplain. And we'd like, if at all possible, if we could get this voted tonight so that we know going into that meeting that we can get that, because seasonally permitting and otherwise, we'd like to get going on the work to, make this a better Title V situation.
okay. Wendy, Karen, do you have any questions?
I don't know.
Okay.
No,
Drew?
I'm all set.
On the, just to go back, do you guys have outdoor seating or anything like that? Or does as far as if you did functions to get to that 260, could that be if you had a wedding or an event after a?
Well, Drew, to answer your question, Bill Arnberger,
Yeah,
they're out on the porch. Out on the porch, there are seats out on the porch also.
yeah.
But I happen to know my daughter got married a couple of years ago there, and we were limited to like 175 wedding attendees.
Okay.
But we're not proposing any difference in the
Yeah.
operation.
Okay. That's all I have. I have no other questions. Wendy, do you want to make the motion?
Sure. I move to approve the septic repair plan of, just 15 Treasure Island Road with the following upgrades requested. 1, request from the current 170 seat capacity to 260 seat capacity. 2, request from the 3 feet to propose 4 feet allowable cover above the soil absorption system. 4, three, request to use IA technology credits, Presby system, to allow for up to 40% reduction in the size of the soil absorption system and allow for 3-foot separation between the estimated seasonal high groundwater and the bottom of the soil absorption system, pending Conservation Committee approval.
Second,
Second,
all in favor?
aye.
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 Okay, so you're all set?
Thank you very
Thank you.
much. Have a
Thank you
good
very
evening.
much.
Thanks, Bill. See you. Bye,
Take care.
Greg.
Bye, bye, Bill, bye, Greg.
Bye.
All right. Next one, discuss vote, Nitron land credit, 132 Maple Street.
Mhm.
Okay, so I'll do this one because, okay, so I'll explain it the best I can.
Okay,
So we had a septic system plan come in for new construction at 132 Maple. They were subdividing their land, and it's now called 131 at that Maple. At that point, it was not 132. So the agent at the time went back to the engineer and said, you don't have enough space to put a new septic system in here because you're in a nitrogen sensitive area, which is in the public water supply, and it's near our wells. So the plan has been here for 3 years. So because it's in a protected site, we had to wait till they could find some land in the area. It has to be in the same water resource area. So they could use that. They needed 12,000 square feet. So they've been waiting to get that. They did find a piece of land on First Parish Road that is in the water resource area. I checked with DEP. They said it was fine. So then we have to go through all this paperwork because it's in a water resource area. This is going to turn into a conservation land, and it has to be sent to the Plymouth Registry of Deeds as conservation land. In other words, they can't build on it. They can't have a pool there. They can't have chickens. They can't have a horse. They cannot have anything on this. The land butts up against conservation land now, so it's fine. It's a fit that will work. So there's 12,000 square feet on that they purchased on First Parish Road. They're going to use that for the 131 Maple Street. So that they can build a septic system there, and then they're given those nitrogen credits back because they have that 12,000 square feet of land on First Parish Road that they're actually giving back. It's very confusing, but bottom line, that's what it means. So because this has to be registered with the Plymouth County deed, they had to use the state form, and on that state form it says that Board of Health needs to sign off on it, Conservation needs to sign off on it, Selectmen need to sign off on it, and then it has to go to the Secretary of Environmental in Boston, and then we can register it with the Plymouth deeds. It's kind of a long process, but that's the only way that we can make sure that this piece of land is going to stay as conservation land and as nitrogen credit land for 131 Maple. So bottom line, that's what it is. So in order for them to build there, this is what they had to do.
okay. And do we have to make a motion or we just vote on it?
You can just vote on it. I sent you one. It should be in your email.
Okay. Do you have it, Wendy?
I do.
Okay.
So it just looks like a plain just move to approve. Nothing else?
Correct.
Okay.
You just moving to approve this.
Okay.
And if you want to give Drew permission to sign the document, because it has to be notarized. I don't know if you want to sign it, Doug, or you want to have Drew sign it. You just have to give somebody permission from the Board of Health to sign
Sure.
this so that we can get it going.
Should we have that in the statement too? Added in there?
Yeah, I would. I
Okay.
would just say that, you give, Drew the health
Designate the director to sign it.
director to to sign off on it. And so then we'll
Okay.
just have that documented as that as well.
And then as soon as we get it, I can do it over at Town Hall.
Correct.
Okay. All right, Wendy.
Okay, let's see. I move to approve the septic design system plan for 131 Maple Street. Approve the nitrogen credit land, again, for 131 Maple Street, pending Conservation Commission approval and Board of Selectmen. We also move to approve the Board of Health Director, Drew Shield, to sign.
Second,
Second.
all in favor?
I'll second.
Aye.
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 Drew, you're gonna have to get it notarized.
Yep, that's all set then.
All right.
Guys on the phone, people representing them, do you have any comments, questions? Good? I guess they're all set, Joan?
I
Okay,
don't know.
okay,
All right.
If anyone wants to speak, they can unmute themselves. So if they want to speak, they should be able to.
okay.
Okay, anything from someone from representing 132 Maple?
No, I think they're all set.
There we go.
Oh.
Hello?
Can you hear me? Yep, this is an agent that's involved with the with that nitrogen credit.
Okay.
And sounds good to me. Yeah, the information that I was given today, it was a little bit confusing because it sounded like from the state level they had indicated that only for a community aggregate plan would need that channel of sign-offs, and that in the last 10 years the local Board of Health are able to alone sign off on an individual facility aggregate plan. But that application is a little bit confusing, so I think this is the move to the next steps, like you just said, unless anybody indicates differently.
Okay.
But that's what information I got today from the DEP level.
All right. Well, that's good, and he'll get that done right away.
Okay, great. Thank you very much.
Thanks. Have a good
Thanks for
night.
your patience.
New business director report.
The director's report. How's everyone tonight? So, we are still in the middle of COVID-19. Currently, we have 9 plans under 45-day review, 7 that have already gone back to the engineer and we're awaiting rewrites or some corrections. We have 2 waiting on Concom, and we're waiting on 23 as-built. We have currently 16 failed systems. As we go forward with COVID, vaccinations are becoming more and more available now that Johnson & Johnson has been approved. The state has upgraded teachers, which I think is just huge. Teachers will now be eligible on March 11th, and that's all school staff, anybody who works within the school, whether you're a janitor or a teacher's aide or work in the lunchroom. If you have any kind of contact down there, you will be eligible to do it on March 11th. Again, the state is encouraging everyone to go to the mass sites. They also have some CVSs that are open in the South Shore. We have a couple in Weymouth, we have one in Hanover, and we also have the mass site down in Marshfield Fairgrounds. As far as homebound individuals, the state is going to be setting up a state program right around March 22nd, where homebound people can call and get put on a list, and the state will come out and organize everything for you to make sure that you get vaccinated. The definition of homebound individuals is pretty specific. So people who do not meet the definition of homebound, individuals who can access a vaccination site with transportation support, even if they prefer in-home vaccination. So if you can get out to your yearly doctor's appointments, even with, if you don't have a car and you take a cab or a Lyft, they're gonna make you go out and get there that way. If you are homebound, if you need 2 or more people to get you out of the house, if you need an ambulance to transport you, then you would be considered homebound. But they really are specific. They really want to push people. That's one of the reasons why they said if you're a healthcare person that helps an elderly person, you can get vaccinated also. So they're continuing by pushing that theme out there. They really want to get people to the mass sites. They can just vaccinate more people there than they can at the local level. We did do vaccinations for people 75 and older a month ago. We did get our second dose of vaccine for those individuals. We got 100 doses. We will be emailing those individuals in the coming weeks so that they know when their next scheduled vaccine will be. So we'll be in touch with them. I'm very excited. We begged and begged and begged for 3 weeks in a row, and it did finally come in. So I was very, very happy about that. Other than that, the restrictions are being lifted. They are, restaurants, you can go back out to restaurants as long as tables are 6 feet apart. Again, no singing. They can have entertainment, someone playing a guitar, but they cannot be singing yet. I know there were a couple of towns that had singing in them over the weekend, and the ABCC has already gone out to make sure that they comply right now. The other big thing is, I just can't stress enough, the CDC just did come out with new guidelines as far as if you are in a enclosed area where everyone has been vaccinated. Let's say you're lucky enough to work in a place where a bunch of 75 and older people happen to work and everybody's vaccinated. Then if everyone's vaccinated and that's fully vaccinated 2 weeks after their second dose or 2 weeks after their first dose of the Johnson & Johnson, then they do not have to wear masks. But that being said, I cannot stress enough, when we are out in public, especially supermarkets, these big box stores, when we are going to and from our tables at restaurants, we make sure that we are wearing our masks. When we're shooting into, the corner store to play our numbers or pick up a gallon of milk, we have to make sure that we are wearing our masks. The mask mandate has not been lifted. It is, it's right up there with the vaccine. If you don't have the vaccine, one of the best ways to protect yourself and others is by wearing that mask. And I will close it down right there. We do have one invoice that looks to be signed. It's a office supply invoice for $28.71.
I approve to have you sign it. Any old business? I don't think. And how are we doing the meeting minutes approval?
Oh, that's right. You should vote to approve the minutes and waive the reading from the prior meeting.
Okay.
So you're looking for a vote to approve, to waive the reading and approve the minutes.
Okay. So just go there, or should I have a motion?
Either Wendy or Karen can make that motion.
I can do it. So I can make a motion to waive the reading and approve the minutes from Monday, February 22nd.
Second, all in favor?
Aye.
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 Okay, there you go. There you go. All neat.
All right. Do we have to do?
I want to thank Teresa for the minutes. They can't be easy doing. So I do want to thank Teresa for that.
Do we have to go back? I mean, that's the first time we've done this in a while. Do we have to do January's, or?
I think because it was brought to our attention right now, and nothing malice prior to. I mean, if that's the case, we'd have to be going back to the very beginning, right?
Right.
Oh, I think as long as we're going forward doing it, we'll be fine.
Okay. Anyone else have anything out there?
No.
Okay. So, make a motion to adjourn the meeting for Board of Health on Monday, March 8th.
Second.
All in favor? Aye.